what I did yesterday when I was presenting critical thinking during the graft preparation and placement, I call this one what went wrong. So we look at the results and we talk about what do you think went wrong. So there's things that you have to look through throughout the surgery to know that everything is in order to ensure good result. But sometimes the results don't show up as expected, so you have to be able to look at the result and trace back and say what happened. So we have a poor growth. So one of the things that I'm going to tell you, I'm going to evaluate here, this side seems, so it's a midline, and this side has a little bit less growth than this side, right? So what could be? It could be the grafts were drying out or being damaged during the graft dissection. So this is during the graft placement. This is a damaged graft. Maybe they were not placed, good grafts were not placed, or too many sites are made in a midline, or they were too deep. So when you're looking at the poor growth, you're looking at all the possible things that could have happened to cause the poor growth. We are very detailed. I'm very peculiar about what we write down. I write who placed on what side, what time we started dissecting, what time we finished dissecting. I write the characteristics of the tissue, characteristics of the hairs, the depth of everything is well noted so that I can go back and look what happened. In this particular case, what happened is the assistant on the right was sorting the grafts too much, and they were drying on her finger. So I knew that she was doing well placing, but I didn't notice that she started developing a bad habit of sorting them through too long. She started placing FUE grafts, which was new to her. So she was used to the grafts from strip. They're meatier, they're better, so she was looking for those grafts that look like a strip graft, leaving them more on a finger. Not only that they're more naked and more exposed, now they were drying more. So that's where this specific case. Pitting is the situation where the skin around the graft gets inverted and creates this indentation. It could be subtle like this, or it can be more obvious like that. Pitting is the problem of graft placement. So does anyone know, was this graft placed in a wrong direction? Was it too dry? Was it too high, too low? What anyone want to guess? Too low, yes, it was placed too deep. Or the site was made too long for the depth of the graft. So it's not always assistant's fault, so you have to kind of reevaluate. It is a team effort. Anyone wants to guess what happened here? This is called compression. The graft doesn't come out, I showed this yesterday, the graft doesn't come out splayed, it comes compressed. Does anyone know what happened here? So the site was too small, so the graft was the graft was not placed in a correct location. So either the site was not measured with the size of the graft, or this specific graft was too big for this specific site, so the grafts were not trimmed properly. So what I'm looking at, it could be a location, it could be the grafts were not trimmed. So this is a 1 hair graft, 2 hair graft, 3 hair graft, but they are placed almost as like they are trimmed as the same size. And so if you look here, if in this area, the sites were made all with the same blade, these hairs splayed nicely and they grew nice looking natural. What I would say is that in this specific case, the grafts were probably too big, they were not trimmed, they were not appropriately sized for the size of the site. What happened here? This is a temporal point. You see the ear here, and these hairs look a little bit too coarse. So what happens here is when we are transplanting hairs, we are looking at finer hairs. Can you see the difference between this hair and that hair? It's a coarser hair versus finer hair. So if you're doing temporal points, in a hairline, the darker the hair, the more important it is to find the finer hairs to the very front where there's no hairs to transition to hairs. You want to make as soft as possible, and especially in temporal points. The other thing is here, I don't know if you can see the difference between this hair and that hair. This is transected, this is telogen. So if the transected hair, we say, oh, it's transected, it won't survive, I put it beside a one hair, and then all of a sudden it survives, it becomes as a two hair grafts. These are two hair grafts placed at the very front. The same thing happens here. This is a telogen hair. If I didn't notice this telogen hair, I place it in the hairline, it looks like pluggy. So you may be doing follicular unit procedure, you're very meticulous, you're trimming your grafts, but location in the selection of your hair grafts matters. What happens here? Why is this a natural result? Wrong color. How is it possible I have a wrong color on the same patient? So yes, so the hair growth. Yes, so what happened is the donor area in the back of the head is usually darker hair, the sides are lighter hair. So if I'm not paying attention and I'm not selecting my grafts, then it's easier to see when we are dissecting hairs, it's easier to see dark hair graft than light hair graft. So when we're dissecting white hairs, we make our grafts a little bit bigger, and it's hard to go and trim and make single hair white hair grafts. So what we do is, naturally this is easier to dissect, so it was easier to keep the darker hairs because it's easier to make one hair grafts from a darker hair, not thinking that this is going to look like that. Yes?
Well, that being said, is that something you would typically counsel patients, say in their early mid-40s before grafting, this can't happen in the future because your temporal hairs are going to gray, or do you have donor site, not donor site,
the dominance.
Site, does it dominate?
From what I've been doing this for 25 years, seeing results in the last 25 years, I've never seen that the hair that was transplanted 10 years ago did not turn gray, so it seems that there's some recipient dominance. But if this is transplant, this is a 60-year-old gentleman, his hair is darker here, it is some mixed in the back, but it was not selected correctly. So even if we can mix these hairs, it can be mixed dark and light, but these here had to be matched with surrounding hairs. Another thing that you have to be careful is when you're doing one hair graft, sometimes there are two hairs, you can't split them. So patient would be, the assistants will be cavalier thinking, oh, I can just put a two hair graft, it won't show, it's light hair. Patient may be excited about the results, start coloring their hairs, and all of a sudden now you have these chunks in the hairline. So everything is about paying attention and thinking ahead. What's wrong here? Why is this a natural result? Temporal points missing. What do you see in a donor area? Is this a diffuse alopecia or is something else happen? Over harvested. So he had two surgeries, strip surgeries, and so someone convinced him that doing the FE procedure is much better than the strip surgery, doesn't leave the scars. So this person went and had FE procedure above the scar, and now it's even worse than it was before. The grafts were damaged and it didn't survive. So be careful, it's not over harvesting. When you're harvesting, you have to kind of think what is left behind and what that's going to look like. And especially harvesting above the scar, you can't come too close to the scar because now the scar becomes bigger and combined with the sites. So hair curl, can you see how these hairs go in whichever direction? It is important to pay attention how we place these grafts. The bigger the graft, the more important it is to place the curl in correct direction. So normally hair grows kind of facing the skin. Even though if someone is, usually hairline has a direction, female hairline will grow up, but most male hairline will grow forward. So when we're placing the grafts, we want to match that curl is facing in the right direction. Even if a physician creates a site at a certain angle and the graft is placed in, if the hair curl is placed in a correct angle, it will complement the angle of the site. But if the hair curl is placed in the opposite, it's going to look even higher than the angle you created. So you keep in mind that everything is a team effort, and how do we do, like, thinking where the curl goes matters, especially hairline and especially in eyebrows and temporal points. Eyebrows are hard to make flat, incisions plus the curl, everything sticks, and there's nothing you can do about it. So that's very, very important. In FE procedure, the hairs are cut short, so it's harder to see the curl. In strip procedure, I always suggest using a shaver with a 3 or 5 day beard, like a length of the hair, like as if you're using a beard length. And then you can see the curl better. So the curl, this is wrong, this is correct, going down. This is the FUE graft. If you see that the FUE graft, the hair doesn't have a curl, it has just the exit angle, but you have an epidermal cap. So the scalp is curved and the caps should fit well so it fits flush. If the cap is sticking out, that tells me that the curl is wrong. Can you see the difference between this and that cap, right? So this patient has, this hair is one quality and a transplanted hair comes in a different quality. So it looks like it's kinky, it doesn't, it's almost like a pubic hair. We believe that it happens by over manipulation of the hair shaft. And so when we're dissecting, the assistants may be scraping with a blade, trying to clean the hair particles, see better. When placing, we may be squeezing too much. When the grafts are too big for the sites, assistants will be forcing the hair graft into the site, and that's damages. So if it happens, it may take a long time for this hair to get back to normal. It may take up to a year or so. So it's not a pleasant experience. What's wrong with this picture? Why is this unnatural result? Yeah, the hair angles are way too up, right? So they're almost 90-degree angle. So this was a patient did a hair transplant many years ago. As you notice, you have to keep in mind, so he lost hairs, his lateral hump started dropping. They transplanted just the hairline at a time, then added it later, a little bit of hairs in the middle, so he lost more. But the point here that I'm trying to make is these hairs are very straight up. So we were able to add hairs in the front and make it look softer. When you're making the hair angles, it really matters. Plus if this is a site and the graft is placed inside of the site, sometimes even the graft, even with the correct curl, may slide a little bit higher. So you're better off going always on the lower angle and then on the higher angle. The other thing is, if the patient comes with a hair standing like this, you can make your grafts now, your new hair transplant, at the right angle, because now the hairs won't style well. So you have to compromise in between so that the new hairs blend with the old hairs. Otherwise, it won't style well. The other thing is, when you're creating sites now, you're going to transect into previous grafts. So keep in mind what is there and how it can look natural one step forward. You can't go too far. So this is another patient. So this is not a 90-degree angle, but you see it's still a higher angle. And this was done not long ago. This patient, maybe in the last 5-6 years, had a procedure done. We were able to, and his donor was really barely, didn't have much. But this is the correction. You make something that is in between. So what I try to kind of keep you thinking. I'm sorry. Here is, think that there are different angles, and you can't go from here to there. As I mentioned earlier, it may not style well. And I have one more. What do you think happened here? Is it grafts not being placed correctly? Grafts too big? It could be too many sites, or it could be too deep. Sites were too deep. And that's it. You have my